And then when else do we brush our teeth?
So she packed them so much and sent them off to seek their fortunes.
Our foundation is really focused on equity primarily, and that is, mostly equity in education and in basic services like healthcare. I think that we were really fortunate, and this was one of the strengths of my parents, was to attract really good people to help them with things. And with this expertise, we came up with these focus areas and sort of also an approach that we call the Hellman approach, which is to be very nimble and to quickly be able to respond to needs in the community, also to be focused on actually getting things done. I'm using the laundered term for that. Getting things done so that, we actually have an impact.
The Hellman Collaborative Change Initiative is really based very simply about how to really take ideas, motivation, leadership, and focus with a lot of persistence from people who are in the community across the public sector, the private sector, the business community, who focus on something that they think is important, that is a chronic issue facing their community, and have been sitting at a table, either literally or figuratively, to come together to think about what can we do to address these needs that individually would be unable to do.
Cavity-Free SF is a multi-sector collaboration made up of a diverse group of stakeholders, all aligned around a common shared agenda or mission.
We want zero cavities, and our children should start out healthy, each and every one. And we're working together to find solutions and implement systems-wide sustainable changes.
You okay there?
Dental problems can really affect a child's ability to eat. There's also the aesthetic impact of a tooth that's visibly decayed. That can diminish their self-esteem. There's also documented evidence that dental problems is a major cause of school absences, and dental disease is almost entirely preventable.
Now say cheese.
So our effort on the Cavity-Free SF was to educate providers on how to do the assessment and then how to apply the preventative treatment of fluoride varnish.
The fluoride varnish application is another major focus of our work. We know it's highly effective, it's evidence-based, it's shown to reduce dental caries in children. So what we do is we promote this practice, this best practice among medical providers. But fluoride varnish really can be applied anywhere by a school nurse, by volunteers, by anybody that's really trained to do so.
You guys all know what we're here to do today? Yes! That's right.
The kindergarten screening data has been so important and critical to the work that we do, because what it does is that it offers evidence to the trends of dental caries over time. It also tells us where the disparities are based on race, ethnicity, geography, where the children live, their zip code. Cavity-Free SF is really about real public health in action.
And who's this? And who's this?
Oakland Starting Smart and Strong is a broad-based collaborative focused on supporting every young child in Oakland to help them succeed in kindergarten, regardless of their race or family income. Children of color often don't have access to supports and resources and experiences that their white peers do. And so a big part of our mission is making sure that everyone has access to these supports and services.
So I was a teacher. I taught in Oakland. I taught for 10 years. And I struggled, particularly with families. They did not receive me very well. And my husband said to me, have you ever thought about asking the families their vision for their kids instead of telling them yours? But I realized he was right. And I started connecting with families and asking them, what is your vision for your child?
You want a stick house?
We start off with asking families all their hopes and dreams that they have for their kids. And then the rest of the workshop series is really about how do we communicate with the child's teacher so that we're making sure those dreams are reality.
My hope for my son is just to be successful, to just do the right thing, you know, to just be a good man.
I built this and this.
So African American students, particularly African American males, English language learners, students who are in foster care, oftentimes if we look at the data, it shows that they are not achieving at the level that they could be. And so we design our outreach to make sure that we are meeting the needs of those families. Research shows that this kind of work really happens best on a team. At our last Oakland Starting Smart and Strong collaborative meeting, we had all the key stakeholders at the table, and we really thought about what do families need to know, feel, and do in order to be connected around kindergarten readiness. The collaborative recognizes that all of these stakeholders are key to a child's success.
ALI stands for the African American Achievement and Leadership Initiative. It was an initiative that was formed in 2015 when I was brought on by the superintendent to think about how do we interrupt an inequitable pattern of outcomes for African American students, looking at everything from academic achievement scores to high school graduation rates, to even just the feeling of belonging and connectedness our African American students and families have within our schools. There have been a series of efforts over the last several decades within San Francisco in an attempt to address African American achievement, but one thing that was not present was the involvement of community partners and families in helping to craft the solutions to best serve our students and families.
100% College Prep is an organization that serves middle school and high school students, making sure that these young people are prepared for post-secondary educational opportunities. When I thought about, my cousin and I thought about starting this program, our community was in really bad shape. We felt like through this work, if we got our young people to see that preparing for their futures was so important, if we could bring them back to our neighborhoods, educated, great citizens, ready to do work in our community, then we win, because their success is our success. And that's why an initiative like Ali is so important, because we could do a lot on the block, but we need to also be in the schools, right? That bridge needs to be built and needs to be strong.
There is a myth that low-income people in the United States do not want to eat healthy foods. It is simply not true. As a primary care provider, I talk to patients all the time about eating a healthy diet. And here in San Francisco, patients would tell me that they really wanted to eat a healthier diet, but foods like fruits and vegetables were luxury items, and they simply didn't have enough money in their budget to afford them.
The basis of EAT-SF, Vouchers for Veggies, is that folks can't afford healthy food, and they live in neighborhoods where there isn't access to healthy food. There might be corner stores that have chips and other unhealthy food, but there's no produce. And when people have less money for food, that means they're not eating healthy food, and they're paying a huge toll with their health, which costs us all in the long run. We work with community-based organizations in underserved neighborhoods. And folks get their vouchers from their health clinic, from their social worker, from their faith-based organization. Once they get that voucher, they use it locally at a corner store, grocery store, farmer's market. When they do that, they're helping develop a habit of eating fresh fruits and vegetables. They're increasing their health when they do that. They're increasing their food security, but also they're helping drive the supply of fruits and vegetables into those neighborhoods, which is really benefiting everyone in that community.
Thank you very much.
Yes, thank you.
Welcome to this matter.
We know that over 90% of folks talk about the fact that they eat less junk food as a result of the program, that they're more confident shopping on a budget as a result of the program. Folks get how important it is to eat healthy, and they feel better on the program, and that's how you make lasting change. And what's great about this is alone, we're not as powerful as we are together. So Hellman Collaborative Change Initiative is exactly what is needed to change this broken food system. It is about bringing community together.
There's another homeless car right here too.
What's that?
There's two people in this one.
This one?
Yeah.
Take a look at the black Mercedes up there. I think that's also.
Everyone Home was established back in 2008 to implement the plan to end homelessness for Alameda County. That's still our role. It includes conducting the biennial census of people on the streets in Alameda County.
Everyone Home is the latest iteration of many years of work and planning around how to address homelessness in the East Bay. Primarily in Oakland, but when we work together to be effective in doing what we do, it's up and down the county. It's from Fremont to Albany.
We have a particular program initiative that was supported by the Hellman Foundation called Homestretch. And Homestretch is focused on people who have been homeless for a year or more and are also have a permanent disability. And so these are often considered the most vulnerable folks out on the streets with the highest barriers to returning to a home without help or assistance.
I feel like there's about 5 camps over there on that side.
Homelessness is a product of public investment and policy decisions. We all made them as citizens. We can unmake them. This is a solvable problem, but it requires the engagement of citizens and voters. And so get involved. Go to your city council, write your state representatives and senator, and let them know that housing is a priority. And plug into Everyone Home, because we're tracking on those issues locally, statewide, and nationally to bring the voice strong and clear that everyone deserves a home.
There's a lot to be proud of with this collaboration. What I'm really proud of and feel so great about when we get together with the directors of the foundation and the various collaboratives and the people who are behind them is that they're getting stuff done. These are people who are committed, they're passionate about what they do, and they don't take no for an answer. For this foundation, that's what we're about, is we really want to use the resources that the foundation has and put it to best use to get things done in the community.